Welcome, everyone. I hope all of you are doing well. My name is Jared Brown, and I'll be the presenter today. And we are going to focus on maybe a topic you have not considered or heard much about. If you're working in the fields of mental health or the criminal justice system, we're going to look at how abnormal psychophysiological responses in the human body may play a role in some cases of problematic, concerning, deviant, antisocial, delinquent kinds of behavior. If you have any questions you think of after today's training, here is my email address. Shoot me an email, and again, I'll always get back to folks, answer any questions you have. Here's a copy of today's training description. So when we think of abnormal psychophysiological responsivity, in this research literature, it has been described as a neurobiological risk factor. So if you remember back to a lot of the trainings we've done together so far in this training series, when we think of neuro, think of the brain, think of neuroscience. Biological, some of those things we've talked about before, it could be like circadian rhythm misalignment, blood sugar dysregulation, hormonal dysfunction. Neurobiological, in my opinion, is kind of where we need to take this field even deeper. Again, we don't want to forget about environmental, family, social factors, psychological factors, all very, very important. But on top of that, we have to consider the role that neurological dysfunction and biological abnormalities can have on the development of problematic, concerning, antisocial, and delinquent behaviors. So maybe you're not working with clients that are 100% involved in the criminal justice system, but they're starting to exhibit really problematic and concerning behaviors. If you can start looking at it through this lens, maybe you could develop strategies, interventions, enhance your screening assessment protocols to maybe help your clients move away from that trajectory that maybe they're on that could bring them into contact with the criminal justice or legal settings. Yeah, we're going to talk about a lot of things today. We're going to look at a lot of practical tips, strategy solutions, screening considerations, and a number of other things. Training objectives. So when you're done with today's module, you should be able to define what is psychophysiology. And we're going to talk about a number of other related topics. You should be able to walk away today also being able to understand some of the causes and the consequences associated with physiological dysregulation. You should be able also to better understand the role and impact physiological dysregulation has on clinical. So this could be mental health or even medical health settings, as well as the role and impact it has on forensic and criminal justice-based populations. And again, we're going to talk about intervention strategies, and throughout today's training, everything's going to be rooted in the peer-reviewed literature. Here's a copy of my brief professional biography. So at this point, I'm assuming most of you know kind of where I come from, but again, I am a professor. I do a lot of trainings in a number of topics. I've done publishing in a variety of topics. I've provided consultation to different groups, different professionals. I have degrees in criminal justice, counseling. I have graduate certificates in a number of different areas, and I try to pull all of this together when I present to hopefully give all of you more of a holistic understanding of the topics that we're digging into. And again, these are some of my certifications and other credentials. And just to remind all of you, these are kind of the main areas that I focus on in terms of learning about utilizing some of this research literature when trying to better understand complex human behavior. This is not an all-encompassing list, but these are the topics in the fields that seem to help me And again, we're focusing on, obviously, through this series, neurocriminology. In this series, you've learned a little bit about neurocounseling approaches. At this point, we should all be able to define what is psychoneuroimmunology. All of us would probably also have a pretty good understanding now at this point how the central nervous system factors into all of this. We talked a lot about trauma, prenatal, and early childhood. We know that a good percentage of folks in the prison systems have had trauma histories, attachment dysfunction, very, very common. Blood sugar dysregulation is a biological abnormality that we need to take into account when considering irrational behavior. The prefrontal cortex, executive dysfunction, metacognition, self-control deficits we've talked about, the HPA axis, hormone regulator, part of our endocrine system, the gut-brain health axis, sleep, alexithymia, emotional blindness, theory of mind, perspective-taking deficit. So brief overview of all of these topics that I've been trying to weave into this series. So psychophysiology, really fascinating area of study. If I could go back in time, I probably would have obtained a degree in this field as well. This is a really fascinating area. If you go online, there are different schools that offer entire degree programs just on this particular topic. So what is psychophysiology? It's a branch of psychology that really focuses on understanding the physiological kind of underpinnings and how it influences like psychological processes. If you look at some of the research on psychophysiology, it also indicates that it is a branch of neuroscience. So you're really taking into account the relationship between our mental health and our physical health and understanding some of those physiological processes that connect the two. And I do, without a doubt, this is a body brain connection as well. It really helps us better understand what's going on in the mind and the body. If you are working with people that have anxiety problems, high stress reactions, extreme fear responses, those are rooted in physiological dysregulation in the body. If you work with people that have certain diagnoses, even insomnia really is a physiological dysregulation, amongst other things, of course. Migraine headaches is related to this field of study. They've done studies on this within the context of arthritis, heart disease, ADHD. The list goes on and on and on. So going a little bit deeper into this field of study, think of it as, again, that mind-body connection. If we apply this research to better understanding our emotional states, if you work with folks that have a lot of emotional dysregulation, lots of mood-related problems, high levels of depression, high levels of anxiety and worry, panic attacks, the very nature of those extreme emotional mood states can absolutely impact physiological functioning throughout the body. When you study this field, you'll also want to learn about the central nervous system, which we've talked about that in its own module in this series. People who are trained in this area likely get training in how to observe and record physiological data, which could be better understanding our sleep-wake cycles like circadian rhythms, heart rate variability, our immune system responses and functioning, how our brain functions, even understanding again gastrointestinal functioning and then gut brain health access. There's a lot of techniques in this field of study that people would get trained on if you had a degree in this that can help better detect and collect data on abnormal physiological responses in the body. Some of them would be EEGs, MRIs, depending on the individual's level of competency and where they work. CAT scans in some cases may be utilized. So there's a lot of different tools and assessments and instruments that professionals in this field will utilize. Going deeper into this, if you look at the research literature as well, you'd probably want to be aware of the term psychobiology. That would be a term you'd probably want to write down and learn a little bit about as it pertains to this field. This field of study really helps us understand the biological bases of human behavior, as well as, again, the neurological aspects of this. If you look at some of the interventions that are talked about in this field of study, neurofeedback and biofeedback have been used. So maybe you're a clinician and you have training in that area. Utilizing relaxation techniques and strategies can actually help us calm our physiological responses in the body down. Mindfulness. If you look at some of the hypnosis literature, there's a lot of things that clinicians probably are familiar with that they use, but they weren't familiar with maybe that partially this could be a physiological intervention technique. If you study this field as well, depending on how deep in the weeds you go, you probably are learning about hormones on some level, and at least some of the literature pertaining to behavioral genetics. So this is a very multidisciplinary field of study that encompasses psychology, neuroscience, sometimes behavioral genetics, the endocrine system, the nervous system, the list goes on and on and on. Depending on the research study you look at and what lens you look through, this field of study also relates to health psychology. I'm a major fan of the health psychology research literature. When, again, if we go deeper in the weeds here, we look at the physiological literature, we look at this through the lens of health psychology. What are some other disorders that maybe we're all familiar with, but we didn't really realize that they have some psychophysiological abnormalities associated with them? Chronic pain disorders. So if you work with folks that are dealing with a high degree of chronic pain, could be fibromyalgia as well. You're working with folks that have a diagnosis of fibromyalgia. Absolutely, that relates to this field of study. What about chronic fatigue? Chronic fatigue syndrome. Yeah, I mentioned migraine headaches before. So just think if you're working with folks with any kind of chronic pain related issues, that is likely related in some capacity to this field of study. Even just tension headaches. Folks with irritable bowel syndrome, you will find plenty of research that talks about individuals with IBS. It's probably very important to understand this field of study. And again, if you are doing any work in the area of like sleep disorders, insomnia, if you're one to deal with insomnia yourself, learning about this field of study may help you better understand some of the neural, bio, psycho, and even social underpinnings that could contribute to chronic sleep-related issues. Homeostasis, so when you think of this particular term, this is when we are getting back into balance in our body. Now, let's say if you're working with trauma survivors and they have constant trauma reactions, or someone's under a high amount of stress and they're dealing with lots of burnout and they're just not ever sleeping well, likely the body is not in homeostasis. It's not in balance. It's not in rhythm. Maybe the gut's off. Blood sugars could be off. If we're not sleeping well day in and day out, that can throw this off. When our body gets back in balance, homeostasis, obviously things seem to work better. Maybe our mood's better. Our hormones are in check. Our temperature in our body is in regulation. This is very common to become dysregulated when you're working with clinical or forensic clients. And part of the reason is extensive trauma histories, the way people eat, excessive screen time exposure can throw this out of whack, meal skipping, the list goes on and on and on. So when you study this, homeostasis is another important term that you would want to be aware of. Now, when you think of, like, let's say potential red flag indicators that maybe the client you're working with is dealing with some level of physiological dysregulation. Again, red flag indicators do not mean with certainty the client is dealing with this. But if you are working with folks that are dealing with severe mood disturbances, up and down mood swings, happy 1 minute, crying the next, flat the next moment, extremely angry the next, that's a pretty good sign that their body is not in rhythm. They're out of homeostasis, and that is partially linked with more psychophysiological dysregulation. The HPA axis plays into this field of study very nicely, and we had an entire training dedicated to the HPA axis in this series. The hypothalamus, pituitary adrenal axis, that's part of our body's main stress response system. So again, when the HPA axis is out of rhythm, that's an indication that likely our hormones are not in check. Our HPA axis, again, is a hormone regulator. It's part of our endocrine system. When your client has overarousal or underarousal symptoms, that is a red flag indicator. Even executive dysfunction needs to be considered within this context. We know that the majority of folks that seek services from clinical and forensic providers likely are dealing with some level of executive dysfunction, working memory deficits, disinhibition, cognitive inflexibility, abstract reasoning, the list goes on. So it is something to consider within that context. If any of you are working in, maybe it's like anger management programs, domestic violence programs, if you're working with clients that have extreme anger control issues, long histories of anger, violence, aggression, if you believe this research, they're probably dealing with some level of dysfunction in the area of psychophysiology. Unusual or extreme fear responses could be a red flag indicator of potential deficits in this area. Even extreme irritability, rumination, and even dysregulated eating patterns could be potential red flag indicators, this research indicates. Going deeper into this, we're going to talk about this today, is heart rate variability and skin conductance levels. This is really interesting. If you look at this through the neurocriminological lens, there's a lot of studies that point to the fact that heart rate variability and skin conductive level abnormalities might be good indications to study within the context of offending behavior. We'll come back to that in a little bit. But if you look at this through a neurocriminological lens, if you put that hat on and we start applying some of the things we've learned throughout this training series, again, lots of things to take into account. What are some of those neurobiological factors associated with engaging in offending behavior? Well, abnormalities in heart rate variability and skin conductive levels are a few to consider. Deficits in brain dysfunction are other ones we've talked about, or dietary practices, exposure to environmental toxins, hormonal dysfunction, so HPA axis issues, could be toxic stress exposure, could be gut-brain health axis dysfunction, birth complications, chronic low-grade inflammation, the list goes on. So there's a lot of them out there to take into account. So heart rate, this is a fascinating area to take into account. When you study heart rate, this gets very complicated, but I encourage all of you, if you're really interested in this, do some Googling online, shoot me an email. There's a lot of different training programs that offer online trainings related to better understanding heart rate variability. When you study heart rate, very important to understand the sympathetic and parasympathetic branches of the autonomic nervous system. Again, heart rate variability may be a biological factor to consider within the context of crime, particularly if you're working with clients with low arousal levels, fearlessness, so they don't have a fear response. That's another variable to take into account. When you study heart rate, there's lots and lots of literature on this, not just within the forensic realm. There's all kinds of literature out there, but they've studied this again within the context of biofeedback, polyvagal theory, autonomic nervous system, the HPA axis. We'll talk about respiratory sinus arrhythmia today, all kinds of different things. And skin conductive levels, skin conductive testing, really fascinating area of study as well. I put a lot of information up here about this, but these are two biological measures that have been studied within the context of criminal behavior. Again, if someone has abnormalities in the heart rate or skin conductive levels, things of that nature, I'm not saying they're going to commit crimes, but it is a biological measure that has been studied in the neurocriminological literature. When we think of physiological stress regulatory systems, so when you look at this, HPA axis, hypothalamus, pituitary adrenal axis, and the autonomic nervous system, we have talked about both of these in this training series quite a bit. So if you have questions about these topics, I would recommend going back to the modules where we talked about these. So our stress response system, why are we talking about this? Because if you're working with clinical or forensic clients, we know that stress levels are higher. The way that some of these clients live their lives oftentimes can contribute to more dysfunction in their body. Untreated mental health, poor eating habits, poor sleep, drug and alcohol problems, excessive tobacco, sugar consumption. All of these things can wreak havoc on our stress response system. If you're working in the area of trauma, obviously you probably are very familiar with that fight, flight, or freeze response. That has a lot to do with what we're talking about on this particular slide. Breaking this down even further, this gets complicated. We're not going to spend a ton of time on this right now. But when we think of different physiological systems in the human body, these are different systems, different functions you would want to be aware of in this training series. Again, we probably focused the most on HPA axis. We talked about inflammation at times and oxidative stress. These are things to be aware of. Emotions have a lot to do with physiological functioning. So where does a behavioral health, a forensic professional come into play? Helping clients improve their emotional mood state is a practical intervention to help us have better physiological functioning. If again, you have clients that have emotional dysregulation, likely it's throwing off their internal physiological processes. High levels of anger, high levels of fear, high levels of depression, anxiety. You treat all of those, that will likely help calm the mind and body down. Emotions is a fascinating area of study that we don't think about. When we think of emotion literature, think of subjective feeling states, think of your client's overall level of motivation, think of their level of cognition and how they process information and how they express emotions and display them to others, and how all of this is interconnected with physiological responses in the body. When we think about emotional regulation, this is a very practical slide too that has a lot of information on it, but let's break it down. When we want to understand emotions and how we can regulate emotions more effectively, This is basically in a nutshell what this literature says. So when we think about emotional regulation, let's just pretend the client has really good emotional regulation capabilities. They're likely in a better position to have greater emotional awareness, emotional clarity. So this would be a client when they're really upset or angry or sad or afraid, they're in a much better position to name their emotions to others. They can name when they feel upset, sad. They don't suppress their emotions. They can accept their emotional responses in themselves and others. If people can't ever accept the emotional mood states of themselves or others, that likely contributes to more dysregulation in the body. Greater levels of emotional regulation can help us achieve our goals more effectively. We're much more likely to be able to have better self-control when we have greater levels of emotional regulation. And when we have high levels of emotions come at us, we get really upset or frustrated, and we have good emotional regulation strategies, we can tap in to better coping skills so we can help reduce those feelings in a much more healthy manner. Now, on the flip side of that, let's say you have a client that presents to you that has extreme emotional dysregulation. These would be areas to dig into and consider, because likely if your client is dealing with emotional dysregulation over and over again, they're probably dealing with some deficits in any of these areas. And these would all be very important target areas for intervention, screening, awareness. And if you can understand this and you can treat the client or utilize strategies depending on what kind of role you play, you're not only helping them achieve greater satisfaction, awareness, competencies in these areas, you're also probably helping them have better physiological regulation in their body. Other things to consider when we think about this is self-regulation. We've talked about self-regulation quite a bit in this training series. But if you look at this through a multi-dimensional lens, self-regulation is broken down into all kinds of different things. We're going to just spend a moment on the top one here. Physiological regulation. So part of having good self-regulation, being able to pause, reflect, think through things, make good decisions, have better patience, have greater levels of ability to delay gratification. One variable you want to take into account is physiological regulation. When you work with clients that have a high degree of self-regulation deficits, they could be dealing with deficits in any of these areas or all of these areas, including physiological regulation. So another critical component to intervention is understanding the topics that we are talking about during today's training. And I've introduced all of you to this field of study, but I want to just spend a little bit more time on this because this absolutely plays into what we're talking about today. When we study psychoneuroimmunology, again, this is, think of it as a paradigm, a multi-dimensional approach to better understanding human illness, diseases, disorders, and even human health. This field of study has a lot to do with understanding the adverse effects that stress has on human health and functioning. This includes prenatal stress as well as early childhood stress. So basically, this field of study focuses on the interconnectedness between what's going on in the brain, what's going on in the body. Some of this research talks about this being the brain immune crosstalk kind of field of study. It involves integrative approaches, so we're taking into account all systems in the human body and the interconnectedness between our behaviors, our mood states, our brain functioning, our hormone levels, what's going on with inflammation in the body. All of these things are talked about in this literature. This is another field of study that relates to health psychology. And basically, if you are helping clients improve coping strategies around reducing stress, having greater levels of emotional awareness, you're teaching clients how to reduce loneliness, you're helping them improve social supports, you're actually helping them also improve immune system functioning, brain functioning. It's a really fascinating area of study. There's more and more research articles that have been published on this field in the past several years. There's a couple journals that are dedicated to publishing research related to this field of study. And again, it's an expanding field of study. It provides great benefits and contributions to all kinds of disciplines, including psychology. If we have psychiatrists in the crowd, it can absolutely help better understand what's going on at a neuropsychiatric level with some clients, neuroscience, physiology, genetics, molecular biology, pharmacology. The list goes on and on and on. And again, psychophysiology really pairs nicely with neuroscience research. And depending on what study you look at, psychophysiology may be a partial branch of neuroscience in general. So, again, to recap, if you study neuroscience, you're really better understanding the brain, how it works, its functions, its structures, how it communicates with other parts of the human body. When you're trying to better understand mental health diagnoses, even criminal behavior, if you have a good, solid grasp on neuroscience research, you're likely going to be in a better position to understand some of those neurobiological underpinnings we've been talking about. And like psychoneuroimmunology, neuroscience typically guides and informs a number of other fields, but it also brings in a number of disciplines under one umbrella. For example, psychology, biochemistry, physiology, neuroanatomy, all of these things are talked about under this literature. If you study neuroscience, again, you've heard me say this probably a million times at this point, you're probably learning about the brain. The brain is complex, of course, neurotransmitters, neuroplasticity. You probably are learning about mirror neurons. When you study neuroscience research, if you look at some of the interventions that have been talked about in this research as well, it does talk about a lot of the interventions we've talked about throughout this series. Meditation, mindfulness, plenty of studies have looked at that through a neuroscience lens. Emotional and behavioral skills training, utilizing non-invasive pro-social cognitive training strategies. And a subcomponent of neuroscience research that I really have found helpful to learn about is social neuroscience. As you know, I'm a major fan of the research literature pertaining to social cognition, empathy, theory of mind. Those would all fall under the umbrella of social neuroscience. And if you study social neuroscience, you want to understand the interconnectedness between neuroscience research and social psychology. And it helps us better understand neuromechanisms that may play a role in social behavior. How do hormones factor into social behavior? Looking at social behavior too through various genetic factors or cellular mechanisms that are going on in the brain. These are all things that social neuroscientists would study. The autonomic nervous system, again, at this point, I think we probably have a general understanding of this. Go back to the module when we talked about the central nervous system. But if we take a step back, let's look at the nervous system again as a whole. The brain, the spinal cord, it involves a complex set of different neurons that are responsible for sending out messages to the body, receiving messages from the body, interpreting this information from all parts of the body. Fascinating area of study. The autonomic nervous system is a component to this. There's all kinds of things, again, that can impact our nervous system. So again, if you're working with clinical or forensic populations, they're probably dealing with some level of nervous system dysfunction. Because just think about this: what we eat, who we associate with, what is our trauma histories like? These are all things that can impact the nervous system, even infections that go undiagnosed. So maybe you're working with clients, unfortunately, have had a long history of homelessness. And maybe they're dealing with some dental health issues and they haven't been to the dentist in a very long time and they have an infection. That can absolutely impact nervous system functioning. Maybe the client you're working with has had a history of traumatic brain injuries, any kind of damage to the brain, structural defects, blood flow dysfunction, autoimmune issues, genetics, metabolic problems, excessive exposures to alcohol and drugs and caffeine and nicotine and sugar. These are all things that can impact the nervous system. Back to the autonomic nervous system. So when we think of the autonomic nervous system, it's responsible for all kinds of things in the human body: blood pressure, heart rate, digestion, urination, sweating. The autonomic nervous system has three main divisions: the parasympathetic nervous system, the sympathetic nervous system, and that gut brain health axis. When we talked about that, the enterotic nervous system. So our gut has its own nervous system that communicates with our brain. The autonomic nervous system plays a critical role in helping achieve homeostasis in the body. So balance. When our autonomic nervous system is out of balance, now we probably are dealing with homeostasis issues. And again, this area of the brain coordinates a variety of physiological factors and events in our body: circadian rhythm, our metabolism, circulation. It plays a role in reproduction, all kinds of things. So really complicated area of the brain, fascinating area of the brain you want to be aware of. All right, so these are three topics you would want to be aware of as it relates to the autonomic nervous system, as well as physiological functioning. These are big, big topics you would want to be aware of. There are multiple studies that have been published on all of these topics. We'll talk about some of these things in a little bit. But this cardiac pre-injection period, this is basically the period between electrical stimulation of the heart and actual blood ejection from the heart. It's a non-invasive cardiological measure. It's a really fascinating area of study. Now, people that have extensive training, degrees, certifications, competencies in the area of psychophysiology would be very familiar with this. There's a whole other branch of physiology that really focuses on neurophysiology. There's some training programs that are out there online related to these things. Respiratory sinusitis arrhythmia is another topic you would want to be aware of when studying this field. So again, there's different training programs out there related to this. By no means, after listening to this, none of us would be qualified to go out and do these kinds of non-invasive kinds of testing. There's lots of testing related to this. There's different equipment that folks would be trained in. But just to introduce you to these terms. And when there are abnormalities in our autonomic nervous system, that should indicate that there's likely something going on as it pertains to physiological dysregulation. And when there's physiological dysregulation, likely that is an indication that maybe our nervous system is not functioning at optimal levels. So, for example, extreme emotional processing weaknesses and deficits and emotional dysregulation could be a red flag indicator of this. extreme dysfunction in our sleep-wake cycles. So chronic insomnia, circadian rhythm misalignment, even dealing with high levels of digestive health issues, sensory processing impairments. These are other things you'd want to be aware of. The parasympathetic nervous system, again, we talked about in previous modules, but this is more the relaxation component of this. We're back in homeostasis. Our heart rate slows down. Our breathing normalizes. So again, maybe you're working with trauma survivors and they have a very intense trauma reaction. Their sympathetic nervous system activates, heart rate goes up. Maybe they feel like they can't catch their breath. They have a lot of anxiety. That is an indication of sympathetic arousal. When we tap into our resources or over a period of time, our bodies get back to balance, homeostasis. That's activating our parasympathetic nervous system. So we're able to calm our mind, our mood state, our body down. How do we restore balance to the parasympathetic nervous system? Again, we talked about this in previous trainings. But anytime we can teach clients improve coping strategies, we can teach ways to help manage conflict, not avoid. If clients are avoiding things, that can actually have adverse effects on this. So teaching improved conflict resolution, getting better sleep, eating healthier, exercising, yoga has been talked about, meditation, deep breathing, even going to a therapist, somebody that the client trusts, respects, they feel safe around. That very nature of a professional client relationship has been linked with helping restore balance to the parasympathetic nervous system. Anytime we can increase resilience, we can achieve goals and set realistic goals. We can help clients improve self-esteem, their self-confidence, and learning how to set better boundaries are all practical strategies, again, that can help restore balance to the parasympathetic nervous system. So the sympathetic nervous system, again, think of hyperarousal issues. We're out of balance. Maybe we have a stress response. We feel more tense. Blood pressure goes up. We can't catch our breath. Our heart's beating really fast. If we look at this through a hyperarousal issue, what are some symptoms you want to be on the lookout for? Chronic hyperarousal issues over and over again in clients, without a doubt, can contribute to more sleep problems, GI issues, so more dysfunction in the gut, might have more racing thoughts, so rumination, catastrophizing. We might have greater difficulty concentrating or sitting still, higher levels of irritability, increases in anger or anger outburst. We might feel easily scared or startled depending on the client and their coping strategies. This could be a triggering event for self-destructive behaviors, impulse control problems, all kinds of things. Just a topic I want to at least introduce to all of you. We're not going to go deep in the weeds in this, but the blood-brain barrier. It is a fascinating area of study. And if you look at the blood-brain barrier within the context of like trauma, allostatic load, biological despair, HPA axis dysfunction, central nervous system dysregulation, dysfunction and abnormalities in our blood-brain barrier have been studied within the context of a number of different diseases and disorders. So the HPA axis, again, just to recap what this is, it is a primary system in the human body that actually plays a critical role in our physiological response to stress. Now, we all deal with stress. We may all handle stress differently. Our bodies may react differently to stress, depending on all kinds of neurological, biological genetic, prenatal factors. The HPA axis regulates the release of cortisol. So this is a very important component of the human body. Under appropriate responses during a stress response, our body kicks in, releases cortisol. It plays a critical role in our immune system functioning. It's a chemical messenger system. And when it's working properly, we respond to stress. Digestion may change for a period of time, metabolism, energy levels may change, but it gets back to balance in a relatively quick manner. Now, if you're working with clients where this axis is not working properly, where it's dealing with hyperarousal issues, or even it's blunted over a period of time where it's not working properly, it's been linked with all kinds of issues in the human body. And if you look at some of the criminological literature, HPA axis dysfunction may be a neurobiological factor to take into account when we're studying criminal behavior and antisocial behavior. There are literally thousands of studies that have looked at different variables as it relates to this axis. In this training series, we again will be talking about hormones and neurotransmitters. So we're not going to spend a lot of time on this, but this is a topic that needs to be understood within the context of physiological dysregulation. So when hormones are working properly, likely the rest of our body is doing what it's supposed to. Think of hormones as our body's chemical messengers. When working properly, it plays a role in our mood states, our appetite, regulating blood sugar levels, sleep-wake cycles, amongst numerous other things. There are a multitude of factors that can adversely impact our hormone health. Again, most of this is very common sense, but if we're dealing with a ton of stress over a longer period of time, that can impact our hormones. If we're dealing with a high degree of conflict with other people, and that conflict goes unaddressed or minimized, or we just stuff those emotions, that's been linked with more dysfunction as it pertains to hormones. Chronic sleep issues, big factor. Chronic obesity has been linked with more hormonal health issues. Living a sedentary lifestyle is another factor. What we eat, people that eat a high degree of processed foods, or even excessive caffeine or alcohol consumption, without a doubt, can impact hormones. People that smoke cigarettes, dealing with any kind of nutritional deficiencies. The list goes on and on and on. So the reason why I point out some of those things, and we'll go much deeper into the module on hormones and neurotransmitters, is that there's a pretty good chance that if you're working with clinical or forensic mental health populations, their hormones are probably not working at optimal levels. Neurotransmitters, again, these are oftentimes, if you look at the literature as well, referred to as our body's chemical messengers. There's a number of different neurotransmitters, neurohormones in the body. Sometimes they can act as, they can complement one another. Sometimes neurotransmitters act as hormones and vice versa. If you look at some of the research literature on neurotransmitters, depending on what study you look at, there may be more than 40 different kinds of neurotransmitters involved in the nervous system. Too many to go through today. Just know they're very important. When neurotransmitters, neurohormones are not working properly, likely that can adversely impact our mood state, our energy level, our fear response, our sleep, our digestion. The list goes on and on and on. So dysfunction, back to the HPA axis. I just want to spend just a little bit more time on this. I know we talked about this in depthly, but it has a lot to do with what we're talking about today. So if your client is dealing with HPA axis dysregulation or dysfunction, Hormones are likely off, circadian rhythms are off, all kinds of things are off. And the reason why I point this out is there's a high percentage of clinical and forensic populations that probably are dealing with dysfunction in this area. If you look at the research literature pertaining to this, again, every client is different, but dysregulation of the HPA axis has been linked with higher levels of anxiety, increases in sleep problems. It could play a role in increasing risk of cardiovascular disease, depending on a number of factors. It can absolutely play a role in social and cognitive functioning, rumination, the feeling of being overwhelmed, having higher levels of irritability, depression, and even it has been shown in some studies that may play a role in psychotic symptoms. So that's a small snapshot of some of the things to be aware of. The reason why I point this out again, if you work with people in any capacity, the more you can understand the HPA axis, I think the better off you'll be with understanding complex human behavior. Okay, so just a little recap, just to keep showing us visually when the brain is off, HPA axis or autonomic nervous system. If you work with clients, history of migraine headaches, there's a lot of research that talks about if you want to better understand the neurobiological underpinnings of migraine headaches, you probably also want to learn about the autonomic nervous system and the HPA axis, because that plays a huge role in how we manage stress, how our bodies process the emotions and stress. And this has been shown to play a role in migraine headaches in some cases. If you work with clients with a high degree of unexplained dizziness, that could be an indication maybe of autonomic nervous system dysfunction and HPA axis dysregulation in some cases. Again, why do we want to understand the gut brain health axis? Because it could play a role in all of these factors. And panic disorders. There's a long list here. These are just a few to take into account. We've talked about temperament a few times in this training series. Why am I back to temperament? Because temperament has a lot to do, not only with the HPA axis, but it can play a role in physiological reactivity in the body. So are you working with clients who are extremely rigid, uptight, or are you working with clients who are just kind of relaxed, go with the flow, easygoing? Temperament is a big topic we want to be aware of. If you study temperament literature, if you look deep in the weeds with some of the traits that are talked about in the temperament literature, it talks about understanding your client's activity level, their mood state, how adaptable are they, how distractible are they, how persistent are they. Those are just a few of the variables that are talked about in the temperamental literature. And childhood temperament as well has a lot to do with this. So if you're working with children and they're dealing with extreme hyperactivity levels, high degrees of frustration, maybe it's extreme impulse control issues. They have that inability to self-soothe. Maybe they have extreme negative affectivity. Could this be partially linked with temperamental issues? Maybe the client is dealing with a high degree of reactive temperamental traits. Maybe they have a high degree of reduced ability to shift attention. They're just not adaptable. They're not flexible. As that client gets older, these are things that can absolutely impact their mood state, their HPA axis functioning, their sleep. The list goes on. Being aware of this topic is critical. And also, again, like we talked about in this series several times over, it's very important to not only understand what was going on directly with the client after birth, but what was going on in utero, what was going on during pregnancy, has a lot to do with understanding a lot of these things we're talking about. And I wanted to remind us when we think about physiological homeostasis, so our body is in balance, the gut brain health axis has a lot to do with this. So if our gut is off, that likely has a negative influence on physiological regulation in the body. And unfortunately, we know from the research literature that a very high percentage of clients with severe mental health issues, drug and alcohol problems, people with extreme negative emotional mood states are likely dealing with gut brain health axis dysfunction. And that should also be a potential indicator that physiological homeostasis may not be in balance. If you again go back to the module where we talked about the gut brain health axis, we know that a high percentage of folks with severe mental health issues are dealing with this. A high percentage of people on the autism spectrum are dealing with gut brain health axis dysfunction. People that are dealing with neurodegenerative disorders, autoimmune issues, allergies have all been studied within this context. If you work with clients with a high degree of fatigue, and we'll talk about fatigue a few times today, and the reason why we're talking about this is because in a lot of the cases I've consulted on, fatigue is a very common symptom that has been reported. And if your client is dealing with a high degree of fatigue, that's a huge barrier for that client to achieve his or her goals. If your client is dealing with a high degree of fatigue over a long period of time, there's a pretty good chance, if you believe the research literature, that physiological abnormalities could be at play. So, another reason why you'd want to study this field when understanding like sleep problems, daytime fatigue. So, when we're under a great deal of stress and we have a physiological response, these are things that can happen in the human body. Body temperature changes, blood composition changes, energy balance changes, all kinds of things can happen. And hopefully at this point, I've convinced all of you that we at least want to learn the basics of psychophysiology. But just in case you're still on the fence, here's a little bit more about this. When you're studying psychiatric disorders, if any of you are working with clients with severe mental health problems, behavioral health conditions, it is very, very important to understand physiological abnormalities and the physiological stress systems that we spoke about before. If you work with clients with a high degree of internalizing symptoms, so again, these would be clients with a high degree of anxiety, depression, loneliness, even extreme shyness, where that really gets in the way of your client's ability to engage in appropriate social behavior. They may be dealing with some level of physiological arousal kinds of issues. So, just another reason why we want to study this, especially working with clients dealing with some of these internalizing symptoms. Depression on the surface could look like a pretty straightforward disorder, but it's not. It's a very complicated condition, disorder, medical health related problem. Physiological dysregulation is a factor to take into account when someone is dealing with depression. HPA axis dysfunction, without a doubt, needs to be taken into account. Problems with our hormones, particularly with serotonin and dopamine and some of the related systems, circadian rhythm misalignment, autonomic nervous system dysfunction, gut dysbiosis, all kinds of things need to be taken into account when working with clients who have severe depression that maybe they go to treatment over and over again, and treatment as usual is just not helping improve their depression. Depression really is a complicated neurobiopsychosocial kind of medical condition, in my opinion. Irritable bowel syndrome is very common, as we learned in the Gut Brain Health Access module, among people with neuropsychiatric issues. Irritable bowel syndrome should be an indication that there's likely some level of physiological dysregulation going on in the body, particularly with our gastrointestinal system. When we study irritable bowel syndrome, know it's a type of functional gastrointestinal disorder. It's an indication of gut brain health access. And depending on the client who has irritable bowel syndrome may also have a higher degree of migraine headaches, sleep issues, anxiety, depression, fibromyalgia. Again, there's all kinds of different things needing to take into account when you study irritable bowel syndrome. If you dig deep in the weeds related to some of the potential factors associated with irritable bowel syndrome, the research literature indicates take into account early life experiences of the client. Trauma histories may be more common in some people with irritable bowel syndrome. Being aware of personality traits have been studied within this context. Even alexithymia, there's some studies that talk about people with higher levels of alexithymia, emotional blindness, emotional processing issues, may actually be dealing with higher degrees of irritable bowel syndrome. A lot of coping strategies are talked about in this literature through a psychological lens, helping your clients improve their coping strategies. So maybe they deal with a high degree of catastrophizing, self-blame, combating that. Drug or alcohol problems can make these symptoms worse. Just treating underlying mood-related disturbances has been talked about in this literature as well. And non-communicable diseases, there's a lot of things, again, I'm throwing at you today, a lot of things to think about. If you work with clients with non-communicable diseases, they're multifaceted kinds of disorders. There's genetic underpinnings, there's physiological, behavioral, environmental factors, but these are known as chronic diseases. And some of the more common non-communicable diseases we're all familiar with are going to be cardiovascular related diseases, certain kinds of cancers, chronic respiratory diseases, diabetes. We know that tobacco use, excessive alcohol consumption, sedentary behaviors, poor dietary practices, and even air pollution are factors to take into account. If you look at some of the literature too, other non-communicable diseases talked about in the research literature, dementia, stroke, hypertension, fatty liver disease. Unfortunately, if you look at the research over the past several decades, we have seen major increases in these diseases in the United States and around the world. You've heard me talk about blood sugar dysregulation several times now in this series, but one of the best things we can do to help improve our health and wellness, including physiological functioning, is to maintain normal blood sugar levels. There's all kinds of things that can throw off our blood sugar levels: meal skipping, excessive sugar consumption, drug and alcohol use, chronic sleep issues. Helping clients learn about the importance of regulating blood sugar levels is very important to optimizing human health and well-being. And in this series, we've talked a lot about blood glucose dysregulation. There's a lot of forensic literature related to this as well. So just know when blood sugar levels are working properly in the human body, we have better cognitive and behavioral flexibility typically. We have better impulse control. When our blood sugar levels dip, hypoglycemia, we might be more likely to be dealing with higher levels of irritability, higher levels of impulse control problems, more executive functioning impairments. So we're going to park the brakes for a moment, and we're going to come back and we're going to talk about this through a trauma and other life adversity lens. Welcome back, everyone. This next section is going to focus on trauma and stress and adversities through the physiological dysregulation lens. So, again, we've talked several times over now in this series about the adverse childhood experiences research literature, chronic and toxic stress. I just want to also remind us that when you're working with folks that have had these extensive childhood traumas, or if the client is currently going through a high degree of uncontrollable stress, which is basically toxic stress, that has also been linked with more physiological dysregulation in the body. And this research really points to the fact that a lot of this regulation is through the HPA axis, and then that throws off our hormones over a long period of time. Again, if you're working with clients that have had these long histories of adversity and they haven't had good coping skills, this can prematurely age the client. So basically, the cellular aging, allostatic load would be a term you'd want to be aware of. An allostatic load would be just more wear and tear in the body, biological aging, more diseases, chronic health issues. So if you've ever worked with a client, and I've seen this firsthand in some cases, you work with a client, maybe you think on paper they're 40 years old, you meet with them for the first time and they look like they're 60 or 70. That could be a potential example of allostatic load premature aging, depending on a number of factors. So if your client has had just a really tough life history, that could be an example of this. So again, we all know what the adverse childhood experiences literature is. The first study was published in 1998. Since that first study, it's looked at this not only within the context of verbal, emotional, sexual abuse, family separation, parental incarceration, domestic violence exposure, but there's also been studies now that have looked at the ACEs research within the context of peer victimization, a child growing up in a home with a problem gambler, a child being thrusted into the child protective arena. The list goes on and on and on. So the higher numbers of traumas your client was exposed to before the age of 18, that's basically the adverse childhood experiences in a nutshell. And what this research has found is that the higher numbers of traumas that have gone unaddressed, unmanaged, greater likelihood the client grows up and has poor health outcomes, maybe more behavioral problems. And again, a very high percentage of clients who are involved in the criminal justice system, if you look at their life histories, have had elevated trauma histories. Toxic stress, again, always bad. When toxic stress goes on, this can create more wear and tear in the body, and that wear and tear is often the result of chronic low-grade inflammation, HPA axis dysfunction, problems with the gut over a long period of time. There's all kinds of things, again, that can contribute to toxic stress exposure. If you're a human being, you've probably dealt with toxic stress at some level. But for the clients that have dealt with it day in and day out, year after year, this is where it truly can lead to breakdowns in our body, including an increase in physiological alterations. So think about all the things that could contribute to toxic stress. Just to remind us from the training we did on the trauma module, the adverse childhood experiences, toxic stress, complex trauma, child neglect histories, clients that have dealt with a high degree of discrimination, racism, marginalization, somebody that grew up in a household and was exposed to domestic violence, chronic long-term histories of economic hardship, without a doubt, can be very scary, frightening, cause tons of stress. Dealing with chronic rejection. So a client who's been rejected repeatedly by maybe family members, classmates, coworkers, the list goes on. Food insecurity is a toxic stress. You've heard me talk about that during the nutrition module in this training. So food insecurity, big factor to take into account as well. Termination of parental rights, going through a high conflict divorce situation. We could spend all day on the different situations or examples that can cause toxic stress. Just know they're many and varied. So this is the allostatic load that I mentioned before. So again, allostatic load has been referred to as a potential index of physiological dysregulation. So prolonged exposure to stress increases our stress hormones, which basically overactivates the HPA axis. So if someone's dealing with stress over and over and over again, it overactivates the system and it creates more hormonal imbalances in the body. So allostatic load, toxic stress, unhealthy coping strategies, wear and tear in the body. These are some of the behavioral factors you'd want to be aware of. So through a behavioral health intervention lens, these are some factors to take into account. Marital status is a factor to consider. So if someone is in a very stable, loving relationship, that is a protective factor. If somebody is in a relationship where it's filled with abuse, that can contribute to allostatic load. If somebody is dealing with long-term relationship breakdowns, loneliness, that can drive up the bus with allostatic load. Helping clients quit smoking, practical strategy. Reducing or quitting alcohol consumption, another protective factor. Sedentary behaviors have been linked with more allostatic load. Exercise can be a protective factor. Poor eating habits make this worse. Better eating habits make it better. Learning how to manage stress is a protective factor. Having very poor coping strategies when dealing with stress, adversity, hardship, conflict can make allostatic load worse. So a big topic that is talked about in the ACEs research literature is a dose-dependent relationship between adverse childhood experiences and more problems with physical or mental health when we get older. So dose-dependent means the higher numbers of traumas in childhood, greater likelihood in adulthood to have poor health outcomes. And what are the factors we'd want to take into account as it relates to this? Autonomic nervous system dysfunction, HPA axis dysregulation, even being aware of epigenetics research, intergenerational transmissions of trauma, gut dysbiosis, gut dysfunction, chronic sleep issues, not taking care of our physical health, not going to the doctor ever, not taking care of our dental health, not taking care of our skin health. The list goes on and on and on. Biological despair is a topic to be aware of in this literature. So when we study biological despair, this is likely an indication that a client is probably dealing with some level of physiological dysfunction. Biological despair is related to more HPA axis dysregulation, autonomic nervous system dysfunction, immune system functioning problems. Allostatic load is absolutely considered within this context. We want to consider potential physiological consequences. And in this literature, it does talk about obesity and hypertension as potential physiological consequences that fall under the umbrella of biological despair. And in this research literature as well, it absolutely talks about considering sleep habits, appetite patterns, concentration issues, restlessness, somatic symptoms, and pain issues when we're considering the topic of biological despair. In the adverse childhood experiences literature, it also talks about threat-based versus deprivation-based adverse childhood experiences. And when we talk about threat-based ACEs, heightened physiological reactivity. When I look at this too, it reminds me of obviously understanding trauma and its relationship to our threat response system dysregulation, fight or flight issues, hypervigilance, insomnia, nightmares, panic attacks. Maybe it's under responding, so someone disassociates, they numb out. Maybe the client ignores danger signs, things of that nature. Very important to understand this literature as well. What goes on in utero plays a huge role in what happens to the client throughout the lifespan. So prenatal exposure to a high degree of maternal stress. So basically, mom is through pregnancy dealing with a ton of stress, and that could come from a variety of sources. Prenatal exposure to maternal stress, according to the research, may contribute to changes in the fetal immune and inflammatory response systems as when the child is born, as they get older, depending on a number of factors, of course. This could adversely impact physiological functioning, lead to more HPA axis dysregulation, and central nervous system functioning. So when you study all these topics, again, I'm throwing a lot at you. There's a lot of moving parts to take into account. But don't worry, we've had modules just on the HPA axis and central nervous system dysfunction. So it's going to help us better understand all of these variables that could play a role in contributing to your clients' poor health and behavioral health outcomes. Prenatal stress, again, it depends on the level of stress, the load, the type, there's all kinds of factors, but this is a good visual again for us to just take a look at here. Traumatic events. So what was going on during pregnancy? Was mom involved, unfortunately, or really exposed to domestic violence? Or maybe during pregnancy, she experienced a natural disaster, a flood, a fire. What kind of psychosocial stressors were going on with mom during pregnancy? Was it just day-to-day life stressors that are just minor, or was it an extreme major traumatic event? And depending on the level of stress and load in mom, this could contribute to more physiological stress reactivity, which would be an indication of maybe HPA axis overload, which then throws out a lot of cortisol into her system. And if she's pregnant, these are all things that can adversely impact that developing child in utero. And what was mom, if any, if she was she dealing with any kind of symptoms of anxiety or depression? There's a lot of research literature that has been published on prenatal anxiety and depression exposure. So food insecurity we spoke about in-depthly during the nutrition module, but I just want to remind us too, food insecurity at any point in life, prenatally, in childhood, or adulthood, can have adverse impacts on behavioral functioning, increases in anxiety, depression, mood dysregulation, but also it can have a profound impact on physiological functioning because partially food insecurity may mean not having much food at all or only having access to food that is cheaply made and not good for us. All of these things can impact behavioral and physiological functioning, and it can impact the gut. It can impact blood sugar levels, inflammation, or immune health. And I would recommend, if you want to learn more about food insecurity, go back to the module on the nutritional deficiencies, and we spoke in depthly about how food insecurity really needs to be considered within the context of criminal behavior and the criminal justice system. Prenatal alcohol exposure. So if you're ever working with a client who's dealing with fetal alcohol spectrum disorder, if you are working with women who are consuming alcohol during pregnancy, this can impact, obviously, a host of capacities in the human body, but also a big component is being aware of neurophysiological dysregulation, that prenatal alcohol exposure can impact fetal development. If you're working in the criminal justice system in the clinical arenas, you're likely coming into contact with clients who have undiagnosed FASD on a semi-regular basis. It is a huge, huge topic to be aware of. So when we talked about the ACEs research, obviously understanding child maltreatment, according to the literature, obviously is a significant public health issue, and it can contribute to psychological issues, depression, anxiety, behavioral problems, acting out as the child gets older, and what we're talking about today, physiological functioning deficits. And it's not just in childhood, but child maltreatment, the consequences can be felt across the lifespan. What about emotional abuse? That is something we need to consider as well. If you have worked with clients that had a long history of emotional abuse exposure, that can absolutely increase physiological dysfunction. It has been linked with more internalizing symptoms, cognitive deficits, interpersonal problems. Over the long haul, depending on the severity of emotional abuse and how long it went on for, it has been linked in some cases to more disordered eating patterns. It can erode self-esteem. It could unfortunately play a role in some instances of suicidal behavior as that person gets older, depending on a variety of life factors. Complex trauma, there's a lot packed in here, but just know one of the things that's packed in here is that complex trauma has been linked with more physiological dysregulation amongst all kinds of other things. So complex trauma, as we spoke about in that trauma module, could accelerate emotional dysregulation, somatic symptoms, attentional problems, behavioral control problems. It's been linked with more dysregulation in relationships and in oneself. So it could contribute to more negative self-concept, feelings of hopelessness, helplessness, empathy problems, boundary issues, trust issues. And one big component of this we need to consider is the role and impact that complex and developmental traumas have on physiological functioning. Breaking it down a little bit further, taking a look at this through a neurobiopsychosocial lens. Traumatic stress caused by child neglect or any other types of childhood abuse can lead to changes in our physiological functioning, emotional functioning, emotional awareness, cognitive health, executive function deficits. Socially, this could play a role in social cognition deficits. Remember, we briefly spoke about social neuroscience before. The reduced ability to regulate affect, so might have more up and down mood swings. It could be higher levels of emotional lability. Depending on the individual, it could have played a role in contributing to more empathy-related problems. Difficulty thinking logically or formulating appropriate decisions. What jumps out at me here, this could be some metacognitive deficits, abstract reasoning deficits, socially inappropriate behavior in some cases. Clients that have had a high degree of child abuse, neglect, may have more friendship making deficits. They might just have a greater difficulty with relationships, working in a group, things of that nature. So these are all variables to consider within this context. When we look at this through that emotional dysregulation lens, go back, remember we spoke about in that last section, just emotions in general. What are the components of emotional management, emotional awareness? So emotional lability, roller coaster ride of emotions, lower levels of emotional understanding. This could be a red flag indicator of alexithymia. It could be a factor in lower levels of empathy, lower levels of emotional self-awareness. Maybe the client has a hard time expressing their emotions to other people effectively. And this could trickle down into having more problems with identifying negative emotional mood states in oneself or other people. Spoke a little bit about marginalization, oppression, racism in this series. This is another factor. This is a trauma. And taking this into account through this physiological lens, if mom was dealing with any kind of racism or oppression or adversity during pregnancy, this may contribute to more maternal physiological dysregulation, which could have an impact on fetal development. Perceived racial discrimination has been studied within the context of the HPA axis. So, racism of any kind or perceived racial discrimination absolutely is a trauma, a stressor, and it can overactivate the HPA axis, which can lead to more physiological dysregulation. You also want to be aware of the SAM axis when studying the HPA axis because these are the two major physiological stress response systems in the body. And if, just in case we have any healthcare providers in here, if any of you are working in the area of understanding cardiovascular disease or cardiovascular disease risk factors, understanding the SAM and HPA axis is also highly recommended. So interpersonal trauma at an early age has been linked. Obviously, we know it can fracture attachment patterns, but it's also linked with more physiological dysregulation. So interpersonal trauma, typically if it's a young child, the perpetrator in most cases is going to be known to that child, mom and dad, caregiver, someone that maybe lives in the home. Lots of trauma in childhood has been linked with fractured attachment patterns, but again, equally important is understanding the role and impact that this could play in better understanding physiological functioning and dysregulation. Attachment, we could spend all day or all week on that very topic. Just know that a high percentage of folks in prison and a higher percentage of people with extensive trauma histories likely are probably dealing with some level of attachment dysregulation, attachment dysfunction. Any of you working in the area of domestic violence, intervention, prevention, wanting to better understand maybe some of the biological factors that could play a role in intimate partner violence perpetration, this is what the research says, is that it's really a fascinating area of study. Understanding that a higher percentage of perpetrators have head trauma and neuropsychological deficits. This research literature also stresses the importance of really understanding the psychophysiological abnormalities we've been talking about today. There could be some imbalances in neurochemistry, so neurohormones, neurotransmitters, other kinds of neurochemicals. Interestingly, as well, they've studied this within the context of metabolism, abnormalities, and our endocrine system. So, again, understanding hormones, the HP axis, the gut, and being aware too that genetic factors have been studied within this context. So I wanted to just show you this here. I believe we'll revisit this later on in the screening section, but when we're talking about the autonomic nervous system within the context of family conflict, what can happen here? These are some things you'd want to take into account when we might have more psychological, behavioral, and physiological dysregulation. So you want to take into account the topic of emotions, cognitions, and behaviors. These are some different things to consider under each of these umbrellas. If any of you work with survivors of trauma who have been diagnosed with post-traumatic stress disorder, PTSD is a very complex disorder as well. And it's equally important to understand the physiological underpinnings of this particular disorder. The research points to the fact that it's very important too to understand the autonomic nervous system. We know that PTSD-related symptoms are many and varied: higher levels of agitation, irritability, depression in some cases, insomnia, hypervigilance. These are all things too that have been linked with more nervous system and physiological dysfunction. So that fight or flight response, again, the client homeostasis is out of balance. We want to be aware that this is a topic to consider, not only through a trauma lens, but through that physiological dysregulation lens. When we think about PTSD through this lens of today's training, what are some factors to take into account? Central nervous system, we've talked about that. Could there be some also underlying autoimmune or inflammatory conditions at play? Maybe. Again, considering the neuroendocrine system and even metabolic dysfunction, and how PTSD in conjunction with other factors may in some cases increase the risk of cardiovascular disease kinds of disorders. Victimization of any kind. So if you're working with survivors of crime, understanding that victimization experiences can lead to dysregulation of physiological systems. Again, we keep going back to the HPA axis, but it's very, very important when working with survivors of crime as well as perpetrators of crime to understand the HPA axis and dysregulation in this axis and how it can contribute to more physiological dysregulation. How can this contribute to more dysregulation in these systems? Well, survivors of crime obviously could contribute to high levels of shock, fear, and anxiety, anger, being aware of the hypervigilant states, high levels of irritability, which can all trickle down and to contribute to more sleep problems, rumination, feelings of shame. It could be betrayal trauma that could be at play as someone isolating themselves now, dealing with panic attacks. What are their coping strategies like? What kind of food are they eating? These are all things that can lead to increases in dysregulation in the human body. Peer victimization, equally important to consider this topic. So if you are working with individuals dealing with histories of being bullied, teased, ridiculed, the research literature points to the fact that survivors of bullying may be dealing with higher degrees of anxiety, depression, somatic conditions such as stomach problems, headaches, and maybe even full-blown PTSD, depending on the level and severity of the bullying. All of these things have been linked with HPA axis dysregulation, the improper secretion of cortisol, which can then trickle down into having more physiological dysregulation and behavioral control problems. Cyberbullying, again, another factor to take into account, has been linked with more physiological dysregulation. Cyberbullying, think about, did the bullying take place online? Was it used with some sort of electronic device? Cyberbullying is another major factor to take into account when we're studying this important and complex topic. If any of you are working in the area of suicide risk prevention, it is equally important to understand that there's a number of neurobiological factors that could be at play in increasing risk for suicide. Now, if you look at the behavioral risk factors for suicide, we know that mood disturbances is a factor to take into account, substance use disorders, trauma histories, family history of suicide. All of these things are very, very important to take into account. But equally important, there's several studies that have talked about blunted cortisol reactivity to acute psychosocial stressors may be another factor to take into account. Basically, what this could indicate is that the HPA axis became overactivated over and over and over again over a long period of time, which then contributed to blunted cortisol responses. And all of these things could also contribute to more physiological dysregulation in the body. There's a number of other neurobiological factors to take into account, but this is one of many you'd want to consider. Another factor to consider is immune system functioning in this research literature. So understanding suicidal behavior is very complex and it requires a biopsychosocial approach to really understanding what's going on with the client, what are all the factors at play. Malnutrition is another factor that could lead to more physiological changes in the body. Part of the reason why this can lead to more physiological changes in the body is the fact that it throws off the gut. And if the gut is off, the brain is off, the gut-brain health axis. When we're talking about now malnutrition or even undernutrition, nutritional deficiencies, it could be food insecurity, all of these things can impact hormones, blood sugar levels, the gut, the nervous system, the list goes on. Childhood poverty is another factor that could play a role in contributing to more physiological symptoms because of the chronic stress exposure, which could be a factor in increased cortisol levels, which could contribute to more allostatic load. These are all things we've talked about now today. And it's not just childhood poverty at play. Any kind of poverty throughout the entire lifespan should be considered within this context. So we talked a little bit about pain before. Pain can be many and varied. There's lots of different kinds of pain-related symptoms, disorders. When we think about chronic pain, some of the disorders or syndromes or symptoms that may result, it could be the cause of acid reflux or ulcers, could be joint pain, back pain, extensive broken bone histories. Cancer survivors may have more pain for a variety of reasons. Fibromyalgia, endometriosis, being aware of headache histories, migraines, being aware of extreme digestive health issues. Could it be nerve damage? Could it be repetitive stress injuries, things of that nature? Could it be complications from a surgery? Chronic pain over the long haul obviously contributes to more stress. It can contribute to a negative emotional mood state. All of these factors could adversely impact physiological functioning in the human body. What about weight? Weight discrimination, obesity. This is another factor that maybe we don't take into account that much. Weight discrimination could lead to more physiological stress responses in the body. So Think of weight discrimination as a kind of trauma, a stressor, feeling humiliated. This is just another variable to take into account. Professionals obviously need to consider this too, because professional burnout can absolutely lead to physiological dysregulation. So if you are part of any organization and you're tasked with developing some kind of burnout prevention program, you would probably do well at least learning the basics about physiological dysregulation within this context as well. The symptoms of burnout are all over the map, but these are a few to take into account. Increases in physiological symptoms, digestive health problems, muscle issues, tension, hypertension, getting sick more often, sleep issues, some of those psychosomatic complaints. It could be unexplained body pain, chest pain, neck pain, those kind of things. Very important to understand this topic. This next section focuses on the neurocriminological and forensic psychological aspects of physiological dysregulation. So again, criminal behavior, very complex, as hopefully you're learning throughout this series. And it's another reason why we're doing this training series, is to dig into all of the weeds that are out there. But when studying criminal behavior through this lens, we want to understand the neurological factors at play, the biological, the psychological, the social, genetics, environmental factors. Could be exposure to pollution. It could be living in a crowded housing situation. We want to be aware of the psychophysiological factors as well, which is the primary focus of today's training. You've seen this slide in a previous training in this series, but when you study forensics, forensic psychology, forensic mental health, these are some of the important topics you would want to be aware of. We've talked about the prefrontal cortex. Very important when studying criminal behavior is understanding prefrontal cortex dysfunction. And again, the heart of this training series is neurocriminology. And in this research, it talks about understanding physiological functioning, dysregulation, and deficits. And if you look at this research, take a look at this. One of the best replicated findings to date is low resting heart rate, which is a component of physiological abnormalities. Neurocriminology, again, a subdiscipline of criminology. It brings in lots of fields of study. Again, at the top of the list is going to be neuroscience research, understanding neuroimaging research, behavioral genetics, biochemistry, psychophysiology, which is the component of today. And it takes into account not only what was going on with your client after birth, but taking into account prenatal factors as well. Other things you'd want to consider again through this neurocriminological lens is again understanding how the brain and other neurophysiological factors come together to better understand what factors could be at play that lead to the development or exacerbation of problematic, concerning, antisocial, offending kinds of behavior. Study after study in the neurocriminological literature talks about the importance of understanding the neurobiological influences of criminal and antisocial behavior, as well as the neurophysiological functioning deficits that we're talking about today. You've also seen this slide in a previous training in this series, but I just want to visually show you and remind us there's a lot of moving parts when studying the neurobiological factors under this umbrella. And today, again, we're focusing on the third one, pathophysiological dysfunction. But this topic is interconnected with all of these topics. So we talked a little bit about prenatal alcohol exposure today, head trauma, poor dietary practices, hormonal neurotransmitter dysfunction. They're all interconnected. So one is not more important than the other. Understanding the biological risk factors that could be at play when studying criminal behavior. Physiological arousal or the lack thereof, poor executive function, CEO of the brain, boss of the brain. These are very important areas to consider. In a lot of cases, folks that work in this field may have more training in executive function, but in my experience, a lot of professionals that work in the field of criminology, forensic psychology, have limited training in understanding physiological kind of factors that could be at play here. Other factors to consider, again, just to show you through the biosocial lens, genetics, behavioral genetics, today, this focus, brain imaging research. Some of these studies take a look at what's going on in the brains of these individuals. The environmental toxins, again, could be exposure to pollution, lead, mercury, secondhand smoke. There's many, many other ones talked about in this literature, but these are some big ones. Other biological risk factors that have been studied within this context: exposure to drugs, alcohol, tobacco products in utero, pregnancy and childbirth complications. You'll find a good handful of studies in the neurocriminological literature that have talked about this. Psychophysiological factors, two of the main ones studied in this literature have been blunted heart rate and skin conductive levels. What role does hormones play? Again, we're going to come back to that in a future module. The neurological insults, brain injuries. How do brain traumas impact various brain mechanisms? The prefrontal cortex, the amygdala, the hippocampus, just to name a few. And then again, the genetic factor. We did not include a specific genetic training in this series, but if you want to study genetics, learn about the gene-environment relationship, the gene-to-gene interactions, intergenerational transmissions of trauma, epigenetics research, very fascinating research. So when we study psychophysiology within this context, again, it helps us better understand cognition, behavior, emotions that are revealed through body events. So we talked about some of those already today. HPA access, heart rate variability, even being aware of vagal tone. Very, very important to understand these topics when studying psychophysiology within the context of neurocriminology. So fear conditioning, again, a major topic to be aware of. Fascinating topic. So if any of you are wanting to take your knowledge to a deeper level, what are some things you want to take into account? Looking at the research on adult antisocial behavior, understanding psychopathy literature. If any of you are really interested in the topic of psychopathy, you without a doubt want to understand the amygdala. You want to understand fear conditioning, emotion regulation, how someone responds to emotions. This really is at the core of understanding criminal behavior, problematic antisocial behavior at a much deeper neuro, bio, psychosocial lens. When you study criminal behavior, again, understanding what is going on in the nervous system, we had an entire module dedicated to that. But if you want to truly understand criminal behavior, this is where I'm at today. Thinking we need to learn as much as humanly possible about the central nervous system and what can happen when dysfunction arises in this nervous system. Because when there's dysfunction in the nervous system, that's pretty much an indication that the rest of the body may not be working at optimal levels. Studying criminal behavior again, understanding the hippocampus, understanding the amygdala. The amygdala has been studied several times over within this context. Just to refresh our memory about what the amygdala is, it's part of the limbic system. It plays a critical role in emotion regulation, emotion processing, and fear conditioning, to name a few. When there's dysfunction or damage in the amygdala, it can absolutely contribute to having more problems understanding like social judgment. It can exacerbate irritability. It's been studied within the context of aggressive behaviors. The list goes on. And again, like all structures of the brain, there's a multitude of factors that can impact the amygdala. High levels of stress, childhood trauma can all impact the amygdala. Exposures to environmental toxins, the list goes on. The hippocampus is embedded within the temporal lobe. It's a complex brain structure. It plays a vital role in memory formation, organization, and storage. Multiple empirical based studies have found that if you're working with folks with a variety of psychiatric or neurological disorders, the hippocampus may be adversely impacted. And when you are working with someone that has damage to the hippocampus, in some cases, it can impact their ability to carry on a conversation effectively. It plays a role in decision making, following directions. People may have greater difficulties in recalling long-term information. They may lose or misplace things more frequently. There's a lot more to the hippocampus than the amygdala, but these are a few things you want to consider. When you study antisocial behavior, if you want to better understand it at a neuroscience lens, these are some of the more common parts of the brain that have been studied within this context. From the lens of physiological dysfunction, you definitely want to be aware of these topics: fearlessness, sensation seeking, and heart rate variability. So when we're talking about fearlessness in this research literature, you would also want to probably Google or write down fearlessness theory. Basically, what that is when somebody has low levels of arousal, this could be an indication that they have lower levels of fear. So traditional forms of punishment may not work for someone that has lower levels of fear. And this could predispose a client to more problematic behavior. This can absolutely get in the way of your client being successful in treatment as usual programs, and it can also lead to ongoing criminal justice involvement in some cases. So low resting heart rate within this context has been studied several times over. Again, there's a lot of variables to take into account, but if someone is dealing with chronically low levels of physiological arousal and they're dealing with criminal behavior histories, this could exacerbate fearlessness behavior and even risk-taking kinds of issues. Low systolic blood pressure as well has been studied within this context. So these are two critical components to be aware of when studying psychophysiology through a neurocriminological lens. Stimulation seeking theory and autonomic arousal are two other major topics you would want to consider when studying criminal behavior. Very fascinating topics. Again, when you study these topics, understanding low arousal levels, fearlessness, it could be an indication of higher levels of risk-taking, self-control deficits. All of these things could bring that client into contact with the criminal justice system. I wanted to just throw this in here. I know we've talked about this in other modules, but again, remember when we're talking about these things as well, it's equally important to consider blood sugar dysregulation, glucose metabolism abnormalities. These are things that have been studied within the context of offending behavior. And these are also components to consider within the context of psychophysiological abnormalities that may be more common among some people who engage in violent behavior or have a full-blown diagnosis of antisocial personality disorder. If you want to study anger control, understanding as well that anger, a component of it, is increased physiological arousal. So anybody that does anger management work, you would do well understanding physiological reactivity levels, psychophysiology literature. Same with aggressive behavior. When you work with folks that engage in aggressive behavior, typically it's complex. It's driven by a variety of factors. The research says there could be some genetic factors at play, the physiological factors we're talking about today. Social factors absolutely play a role in this, as well as environmental considerations. What are some risk factors for aggressive and violent behavior talked about in the literature? We're not going to spend time on large body size. This is outside my scope, but it has been talked about within the context of this literature. Fearlessness, we just spoke about that before. So during an extreme stress response, the client has low levels of reactivity. Maternal smoking during pregnancy could be a factor. Birth complications combined with early maternal rejection. So when you're working with folks with aggressive and violent behavior, the factors associated with this are likely many and varied, as you can see here. If any of you are working with young children through an intervention and prevention lens, these are some other factors to take into account if that child is referred to you who has chronic aggressive behavior. Maybe a parent reaches out to you and needs some consultation. These are some other factors that could be at play that get deeper into the weeds in terms of what could be driving these behaviors. By no means is this an all-encompassing list, but these are factors to take into account. Inflammation. I might put a training on for APHIS in the future on this, but chronic low-grade inflammation, poor inflammatory responses, higher levels of oxidative stress. Some studies have pointed to the fact that this could play a role in some instances of aggressive behavior. Reactive aggression, probably going to be more common in most clients you work with, not always, but most. This is going to be more in the moment, not thinking through things. People are more irritable, more impulse control issues. This could be indicative of more self-control problems. Reactive aggression has been linked with higher levels of physiological arousal and reduced inhibition. So that's more difficulty in putting on the brakes, pausing, reflecting, thinking through things. When you study reactive aggression through the lens of today's topic, this is one article of many that it really talks about the importance of understanding arousal levels, including lower arousal levels for some of these individuals. For some individuals, too, increased arousal levels, heart rate issues, greater cortisol reactivity, which should be indicative of overactivation of the HPA axis. If you are working with a client who's referred to for disruptive behavioral disorder, multiple studies have looked at this within the context of physiological dysregulation and it being a potential biomarker. Other things to consider, again, like we've talked about before, understanding the autonomic nervous system, hypoarousal, so low arousal levels could be an indication of problematic behavior, being aware of sensation-seeking theory and fearlessness theory are talked about in the literature. Internalizing symptoms, again, depression, anxiety, externalizing behaviors, going to be more anger, violence, aggression, rule following problems. Both can be problematic. Both could be indicative of increases in physiological abnormalities or dysregulation, particularly if you're working with clients with externalizing behavioral problems, more fighting, bullying, hitting other people. Maybe they're non-responsive to punishments, hard to manage behaviors. Several studies have found that physiological dysregulation should be considered within this context. Anytime you study criminal behavior, problematic behavior, in my opinion, equally important to understand attachment theory. Solid attachment bases likely are a protective factor against increases in physiological dysregulation over the long haul. Dysregulated attachment patterns could contribute to more physiological arousal issues, especially if that client has very poor coping strategies. I would say most children don't have proactive aggression tendencies, but if they do, this might be indicative of emerging problems later on in life, particularly without early intervention. Could this be an indication of a low fear response? In some cases, the answer would be yes. Being aware, as I spoke about before, victimization, poly-victimization would be people that have victimization experiences from a variety of sources. And when you study all of these things within this context as well, understanding endocrine physiology. So that is why I spent so much time again talking about the HPA axis, the gut. When our endocrine system is not working properly, as a result of repeated exposures to stress and a variety of other factors, it could be a variable to take into account with later problematic behavior. And we talked about this within the context of intimate partner violence. But again, intimate partner violence exposure, particularly during childhood, could contribute to more emotional dysregulation as that child gets older. And part of the reason is infant physiological dysregulation is an indication of increased cortisol reactivity, which are all factors to consider anytime you're working with someone that has a long-standing pattern of emotional dysregulation. And I think we've covered this pretty well now, but again, if you're working with perpetrators of domestic violence, just know that all of these things we're talking about today should be considered, if possible, during a comprehensive screening and intervention process. If you work with individuals who are extremely hostile, they may have an exaggerated sympathetic stress response. So understanding the HPA axis, the nervous system, how to get the body back to homeostasis, activating the parasympathetic nervous system could play a vital role in helping hostile men reduce that behavior pattern. The very nature of being incarcerated can lead to more physiological changes in the body as well as psychological changes. And part of the reason, again, is the overactivation of the HPA axis. Parental incarceration is another factor to take into account. So a child who had a parent incarcerated may be more likely to experience biological dysregulation. What could that be indicative of? Depending on a host of factors, physiological dysfunction, psychological issues, more allostatic load, biological despair. Other things to consider if you're working in the criminal justice system, it's equally important to consider somatic health issues within your clientele. And it's likely that a higher number of folks in prison and people released from prison back to the community likely are dealing with more somatic-based health problems because of all of these moving parts that we've been talking about today. Not going to spend much time on this, but I just wanted to show you, if any of you are interested in the topic of serial killers, why people commit serial murder is many and varied. But if you look at some of the literature through the biological lens, it does talk about considering all of these things we're taking into account today: physiological factors, hormonal dysregulation, genetic factors. A little bit more about serial killing. Again, if you're interested in serial killing, just shoot me an email. I have a lot of podcasts I've done on the topic. And sensation seeking has also been talked about within the context of serial offending. Thankfully, serial murders are very rare, but if you're interested in studying them, looking at it through this neurocriminological lens is also recommended, in my opinion. And physiological arousal has also been talked about within this context. If any of you are working with extremely high-risk sex offenders who would also be classified as a sexual sadist, there's some literature that talks about digging deeper into hormonal changes because it could provide you with valuable physiological data that might help better understand and maybe develop more of a biopsychosocial intervention treatment plan. The same with psychopathy. If there's several studies that have found that people with true psychopathy may have more abnormal physiological responsivity, particularly as it relates to the fearlessness response. The same with incarcerated individuals with psychopathy. Physiological hypoarousal issues have been demonstrated in several studies. And other things to consider through this neurophysiological basis of antisocial or psychotic behaviors: understanding how the person regulates impulse control, emotional arousal, affect, and aggressive feelings. Not a lot of literature on this, but just in case any of you are working with white collar criminals, it is talked about in this literature as maybe an area for future study to maybe dig into more of the research related to brain-based findings and psychophysiological differences within the context of white collar criminal behavior. And if any of you are working with individuals who are dealing with a history of road rage, these might be some physiological responses to take into account when studying it through this lens. And before we wrap up for another break today, these are just a few things you'd want to take into account in terms of what the research says that could contribute to poor treatment outcomes among children with antisocial behavior. I point this out is because this is a great example of all the variables that we've been talking about today and throughout this training series. So we'll come back in just a few minutes and we'll wrap up today's training with a discussion on screening and intervention considerations. Well, everyone, this next section is going to focus on just screening considerations, different things to take into account. Obviously, today's training for some of us might be the first time we've taken a deep dive into the area of psychophysiology. So whatever role you play, make sure you have the proper training, credentials, background in these areas. So just always have to say that. So when we think about, again, the factors that could contribute to physiological dysregulation, they're all over the map. We've talked about all of these now today, but arousal issues, emotional lability, up and down mood swings, high degrees of stress, not being able to manage frustration or conflict, extreme fatigue, sleep issues, blood sugar dysregulation, particularly lower levels of blood sugar levels, so it could be hypoglycemia. All of these things have been linked with physiological dysregulation. Again, this is not an all-encompassing list, but these are some things to take into account. You've probably seen this slide in other trainings I've given, but I like to just include it because if we look at this through an emotional health lens, These are things that are threats to our emotional health. And if something is a threat to our emotional health, it's likely a threat to our cognitive health, to our physical health, and even physiological health. So take these things into account. This is not an all encompassing list, but it does encompass some of the main variables that I have seen over the years working with clients, consulting on cases. So, again, alexithymia, emotional blindness, trauma, burnout, not sleeping that well, chronic loneliness, self esteem, self worth issues. These are all things that can impact our health and wellness on all kinds of levels. So, if you work with clients that have a high degree of emotional dysregulation, that should be indicative of that can and probably does in a lot of cases contribute to more physiological dysregulation as well. So through that screening lens, what are some things you want to take into account? If your client is dealing with difficulty in understanding their emotional mood state, the awareness of emotions, that could be a factor to take into account. Can they accept emotions, or do they have just a really hard time with emotional acceptance? Impulse control problems, particularly when they're really frustrated, upset. And what is your client's ability to use strategies maybe they've learned in the past and apply it to future situations to help them reduce emotional dysregulation? These are just some things to consider through that screening lens. And contributing factors, again, all over the map. What is their stress management strategies like? When they're really stressed, does the person turn to tobacco products? Do they have a tendency to engage in high risk behaviors when under a great deal of stress that could place them or other people in harm's way? These are factors that could also contribute to more physiological dysregulation. The frontal lobes, again, we have talked about that several times in this series, but I wanted to just show you here potential symptoms that could be indicative of frontal lobe or prefrontal cortex damage or dysregulation. This is not a diagnostic tool. These are just potential red flag indicators. But if you have clients that have a long-standing pattern of communication, language, speech problems, maybe poor coordination could be a factor. Changes in personality are actually quite common among clients who've sustained a brain injury. Impulse control problems, planning, organization, time management. If you form a schedule with that client and they just can never keep a schedule, maybe a red flag indicator. Information processing deficits. Basically, what that is your client probably has a hard time taking in a lot of information in a timely manner. Memory problems, problems with decision making, panic issues, high levels of irritability. These are just some red flag indicators to be on the lookout for. And some of these factors here could lead to more physiological dysregulation. You've heard me talk about neurocounseling a few times in this series. Neurocounseling research can really help us better understand complex human behavior as well. So basically, neurocounseling is the infusion of neuroscience research into counseling practice. And in this research, as part of a neurocounseling assessment, it does talk about understanding physiological functioning in the clients you work with. You've seen this now in this training series, just a good reminder of all the moving parts that could be at play when trying to understand neurological dysregulation. And when your client is dealing with neurological dysregulation, likely they're also dealing with some level of physiological dysregulation. It's very difficult to separate the two. So we talked about some of these in this series. Let's just pick out one, for example. So the technology piece, excessive screen time exposure can contribute to neurological and physiological dysregulation. This is not a diagnostic tool either. It's just a helpful reminder of a lot of the moving parts that we need to consider. And again, when you study physiological dysfunction, it's equally important to consider your client's lifestyle practices and social history as well, because certain lifestyle practices could contribute to more physiological dysregulation. For example, if your client has an over reliance on processed foods, Western diet foods, they consume a high degree of sugar sweetened beverages, energy drinks, these kind of things can contribute to more physiological dysregulation as well. Looking at this again, let's just break this down. There is all kinds of dimensions of dysregulation. When a client is dealing with dysregulation in one area, it likely impacts another area. So physiological dysregulation likely falls more under this umbrella here. But if your client's dealing with a lot of stomach issues, racing heartbeat, especially when they're scared and they get fearful a lot, they seem to have a lot of panic issues, your client's not sleeping well, they're dealing with a ton of daytime fatigue. These are all indicative of some level of physiological dysregulation. But again, you also want to be aware what's going on socially with your client. Social neuroscience research, social cognition. Maybe there's some intellectual functioning deficits. Again, we talked a lot about emotions and behavioral dysregulation. They're all interconnected. This is interesting. I'm not going to spend time on this today. It's kind of outside the scope, but I just wanted to point out here that there are methods in the literature that talk about detecting physiological dysfunction or dysregulation when trying to detect possible deception in individuals as well. Again, what's going on prenatally with your clients has a lot to do with what we're talking about today and what was occurring during pregnancy in terms of dietary practices. Poor prenatal nutrition has been linked with more autonomic nervous system dysfunction, which is indicative of more physiological dysfunction. Emotional eating could play a role in physiological dysregulation. Emotional eating could be driven by many things. So, what is your client's negative emotional mood state like? Are they dealing with a ton of anxiety, high levels of irritability? Are they turning to food to cope? This could contribute to more physiological dysregulation before, during, or after the emotional eating incident. Chronic stress may increase sugar consumption. Excessive sugar consumption can contribute to more physiological dysregulation, as well as chronic stress. So, very important too to understand the interconnectedness between the two. My experience with consulting on a number of complex cases over the years, a high percentage of clients seem to have an unusual or problematic relationship with sugar, particularly when they're dealing with tons of stress, trauma, adversity, or hardship. So we've talked about blood sugar dysregulation now, again, several times, but learning more about this topic and learning about the importance of helping individuals optimize healthy blood glucose levels can play a vital role in helping clients maintain a healthy physiological functioning, a healthy emotional, healthy psychological, and healthy brain functioning. Food intolerance, very important topic to take into account. Food intolerance can lead to physiological dysfunction in the body. It's just another reason why, again, working with a qualified nutritionist, dietitian, healthcare professional. If you work with clients that consume a high degree of energy drinks, again, they're probably consuming not only a high degree of caffeine, but depending on the drink, probably a high degree of sugar as well. So taking this into account, because excessive energy drink consumption has been linked with having more physiological effects on the body. Increased heart rates, heart rhythm irregularities. It can increase blood pressure levels. We talked about this in the gut brain health access training, but I also wanted to show and remind us that consumption of aspartame in some cases, depending on the study you look at, may impact the gut. It could impact neurophysiological symptoms. There are some studies that have looked at aspartame consumption within the context of insomnia, headaches, depression, anxiety, irritable mood states. It's just another variable to take into account when we're considering maybe all the factors that could contribute to more physiological dysregulation in the human body. So very, very important. If you want to understand physiological dysregulation in the human body, we talked a lot about the brain, but equally important is to understand what's going on in the gut. I believe I introduced all of you to this topic in another training, but sickness behavior is something we've all experienced, especially if we've been sick or had a cold or flu. This is a normal response to an illness or a virus. But for some people, if they have a weakened immune system, they get sick over and over and over again. Sickness behavior over the long haul has been linked with all kinds of problematic outcomes, including behavioral changes and physiological changes in the body. If you look at the research on sickness behavior, the major components of sickness behavior increases in depression, anhedonia, fever. It could contribute to cognitive impairments, especially around memory and attention, more sleepiness, decreased activity and social interactions. Another topic to consider. Neuroinflammation, again, another topic we've talked about in this series. But if your client is dealing with a high degree of neuroinflammation, inflammation in the brain and spinal cord, and neuroinflammation is a complex topic with immune system functioning underpinnings, physiological, biochemical, and psychological kinds of consequences that could result from this. What we eat plays a huge role in physiological functioning, including all aspects of health and wellness. And dietary patterns and sleep patterns go hand in hand as well. So people that don't eat healthy may be more likely not to sleep well. People that eat a very well-balanced diet and take care of themselves may sleep better. So very important to understand the interconnectedness. Circadian rhythm misalignment and disruptions have been shown to be quite common in a number of populations, including individuals with drug and alcohol problems, mood disturbances, a variety of medical health issues, and disruptions in circadian rhythm alignment seem to play a role in the pathophysiological aspects of psychiatric disorders, such as anxiety, depression, bipolar, amongst others. So insomnia disorder is a hyperarousal issue. So people that are dealing with insomnia, it could be a full-blown disorder. It could be a symptom. It could co-occur with a variety of disorders. We've all dealt with insomnia on some level, on varying levels. But if someone's dealing with chronic insomnia, that likely plays a role in contributing to greater levels of physiological dysregulation. Chronic insomnia symptoms are many and varied, but it's been shown to increase anxiety, memory problems, concentration issues during the day, It could play a role in increasing depression, irritability. It can get in the way of relationships. It could be a factor to take into account with safety considerations, poor decision making, just being more clumsy. There's several studies in the forensic literature that talk about insomnia being significantly elevated among people in prison. If somebody is dealing with sleep apnea, be aware that this could contribute to more physiological dysregulation in the body, nervous system dysfunction, chronic sleep apnea may increase anxiety and depression. It is a major topic to be aware of. There's varying forms of sleep apnea, obstructive sleep apnea, probably one of the more common ones. I've worked with numerous clients that have had obstructive sleep apnea. Being aware too, just multiple things to consider. If you're working in clinical or forensic settings, you're probably working with clients too that are either dealing with diagnosed or undiagnosed obstructive sleep apnea, more frequent than you probably realize. Obstructive sleep apnea, particularly when it goes undetected and untreated, has been linked with more executive function impairments, higher levels of depression, anxiety, hyperactivity issues. It can impact our memory. It can impact motor functioning, and the list goes on and on and on. Other physiological changes that may result from obstructive sleep apnea, working with a qualified healthcare professional, a medical doctor typically would have advanced training in this, would be able to educate the client about all these things, and treating obstructive sleep apnea can play a role in reducing or eliminating these potential physiological changes. Being aware too, when you're working with folks with mental health disorders who have very poor lifestyle behaviors, they don't eat well, smoke cigarettes, sedentary behaviors, they lack social support, all of these things can contribute to an increase in inflammation in the body, more metabolic dysfunction. All of these things can impact hormones, the HPA axis, or eating patterns. It can lead to more physiological dysregulation in the body. If you're working in substance use treatment, you would probably do quite well learning about all of these topics from a physiological lens. When you work in substance use treatment, a couple things I'll say about that as well. Blood sugar dysregulation has been talked about as a factor to consider. HPA axis dysfunction, food insecurity may be significantly more common among clients with severe drug and alcohol problems. And it's not just drugs and alcohol we need to take into account. Histories of tobacco exposure, sugar, caffeine, fast food consumption, being aware of excessive screen time exposure, some of those behavioral addictions may be another factor to consider in this discussion. If you have clients that are combining alcohol and caffeine together, that just makes physiological dysregulation even more intense. So another variable to consider. So again, if let's say a client is combining alcohol with an energy drink, even more adverse outcomes can result. Fatigue, as we talked about a few times now, I just want to remind us, be aware of fatigue. It's complex, it's multidimensional in nature. If we look at this through a pathophysiological risk factor lens, we've talked about most of these today. A dysregulation inflammatory cytokines, basically, that's an imbalance in our body in terms of like oxidative stress and free radicals. The hypothalamus is off, so that's indicative of HPA axis dysfunction. Changes in the serotonin system. We'll talk about serotonin in greater detail in our upcoming module, but if there's changes in the serotonin system, it can impact the central nervous system, circadian rhythm misalignment, melatonin secretion issues, lots of moving parts when understanding fatigue. If you have clients that are dealing with a high degree of loneliness, isolation, separation, they just feel cut off from other people, this is a threat to their health. And it has been shown to lead to profound disruption in the ability to regulate physiological states, which over the long haul can compromise physical and mental health. Rumination is a threat to our health. Rumination within the context of chronic health conditions has been shown to maybe accelerate or exacerbate cardiovascular disease risk factors. It could play a role in obesity in some cases, chronic pain. Another huge topic to be aware of if your client has a history of rumination. Emotional dysregulation, I think we've covered that pretty good now today. But again, if your client is dealing with a high degree of emotional dysregulation, a high degree of irritability, there's a pretty good chance that these behavioral symptoms can exacerbate physiological dysregulation, which could then impact other body systems. And if you're working with parents through a family systems lens, if that parent and child have a lot of conflict going on, maybe there's poor parenting practices, the child is dealing with a number of mental health or behavioral health conditions, things of that nature. Maybe there's fractured attachment patterns. HPA axis dysregulation can be more common in both the parent and the child, which then can lead to more physiological dysregulation. And over the long haul, could accelerate poor health outcomes for both parent and child. Finding out how often your client is on the screen is important. In my opinion, I think the research is pretty clear on this too. Excessive screen time exposure is a threat to our health. It can impact psychological health, social, emotional, physical health. It can lead to more physiological dysregulation. If you want to throw off your sleep at night, stay up late and be on the screen, work late at night, watch a really anxiety provoking show. All of these things can make our health worse. If you want to improve physiological functioning, reduce screen time exposure, especially in the evening hours. If you have clients that play a high degree of video games, depending on the time, the nature, and the duration, it has been linked to increasing heart rate, blood pressure, sympathetic tone. It can play a role in food intake. It can lead to more physiological arousal and the overactivation of the HPA axis. Violent media exposure as well, digging into your client's history of exposure to violent media, games, movies, music, things of that nature. This is another variable that could play a role in physiological arousal. So again, this might be some screening things to consider, but finding out, does your client have a tendency to view these things repeatedly? And maybe the clients don't connect the dots that their excessive viewing or exposure to these kind of things is actually contributing to more dysregulation in their body, which could accelerate sleep issues, gut health issues, fatigue the next day. What's going on in the neighborhood as well? If your client is exposed to a lot of stress, adversity, hardship, worry in the neighborhood, that could play a role in accelerating physiological stress and more wear and tear on the human body. How does your client evaluate themselves? If they have a negative self-evaluation, if they make a mistake, does a lot of shame kick in? What's their self-esteem levels like? These things can overactivate the HPA axis, lead to more cortisol secretion, lead to more dysregulation in our physiological processes. If your client has a tendency to suppress their emotions, emotional suppression is a threat to our health over the long haul, and this can lead to more physiological dysregulation as well. So a couple things to consider is, how does your client handle anger? sadness, grief, frustration, stress, if they struggle in all of those areas, those could be very important target areas for intervention. Alexithymia, again, emotional blindness. Alexithymia has been found to be very common in clinical and forensic settings, and maybe as high as 50% or more in some populations. And alexithymia has been linked with having more dysfunctional breathing patterns, which could accelerate anxiety, which, if we're dealing with a high degree of anxiety, it's probably contributing to more physiological dysregulation. And I think I mentioned this in the alexithymia training, but want to remind us too, if you are thinking about developing a burnout prevention plan, consider everything we're talking about today, but also equally important, considering the role and impact alexithymia may play. Interventions, again, utilizing neurocounseling approaches, understanding this field of study can be very, very helpful. If you are a licensed therapist, understanding the research literature pertaining to neuropsychotherapy, very similar, if not almost the same as neurocounseling literature. If you can infuse neurocounseling literature into your practice, again, I want to remind us, it can help improve a client's emotional, behavioral, and physiological states. Becoming attachment informed, very important when you study attachment theory. Understanding physiological, emotional, cognitive, and behavioral functioning, very important. Higher levels of emotional intelligence may play a role in helping calm down the body physiologically. Higher levels of emotional intelligence have been linked with greater levels of happiness, our ability to manage our anger more effectively. When you study emotional intelligence, you want to understand the literature pertaining to trait emotional intelligence. If your client is dealing with any limitations in any of these areas, they could be very important target areas for intervention. And a lot of these here, if your client is dealing with limitations in some of these areas, for example, for stress management, they might be much more likely to be experiencing some degree or level of physiological dysfunction. And unfortunately, the research literature supports the fact that offender-based populations may be more likely to be dealing with lower levels of emotional intelligence. And if that's the case, it could trickle down into that client having greater difficulty in social problem-solving abilities, lower levels of empathy, their social competence may be lower, they might have more inflexible thinking, they might be more impulsive, and they have maybe higher disregard for other people. These are other variables that could indirectly negatively affect physiological functioning in that individual. Promoting social support, enhancing social outcomes, friendship making abilities, communication abilities is very, very important. And it could play a role in reducing harmful physiological responses to trauma as well. So enhancing social support, another very, very important variable. In this literature too, it does talk about physiological attunement. Understanding this literature can be very helpful. And I think there's a very strong argument to be made that this really is a component of attachment, forming attachment early on, making sure the parents are extremely attuned to that child can help that child develop increased resilience as they get older to stress, which then can help improve emotional, social, physical, and physiological functioning. This is all very common sense. We all know this, but the more we can infuse healthy coping patterns early on in life and during pregnancy, and we can help that pregnancy as much as possible be free from trauma, adversity, and hardship, that likely will play a role in improving physiological outcomes for that developing child. In the neurocriminological literature, it does talk about briefly physical exercise a little bit, and it does talk quite a bit about nutritional interventions. So if you want to help people improve physiological functioning, a lot of it's common sense, but exercise, eat more, get better sleep, learn how to manage emotions. Those are all critical components to this literature. Understanding again the psychoneuroimmunology literature, and in that literature, it also talks and stresses the importance of understanding nutrition. So that is one reason why we had an entire module dedicated to the topic of nutrition. It does play a role in combating problematic behavior. If we can increase resilience, we can help people develop skills to help them bounce back from tough stuff, especially if you're working with trauma survivors. This can help them improve physiological functioning as well. So, helping people develop greater levels of resilience is a critical component to this. There's a multitude of factors that can influence resilience. If you look at it through the neurobiological lens, taking into account these factors here, today we're focusing on the physiological processes. If you can infuse this into counseling practice, mental health care, any kind of setting you're working in, it may also play a vital role in enhancing neuroplasticity. Helping people get better sleep is a critical component of this. Looking at this, sleep is a physiological need. So if we get good sleep, we are enhancing our physiological health. If we don't sleep well, that is adversely impacting our physiological functioning and health. We've talked about circadian rhythms now. How do we improve circadian rhythms? Develop a consistent sleep-wake schedule has been talked about in this literature. Getting more natural sunlight in the morning, consulting with healthcare providers, getting appropriate amounts of exercise, having consistent meal times, trying to avoid late night snacking, binge eating, improving digestive health, managing stress more effectively, avoiding insulin spikes, limiting screen time exposure, especially after the sun sets, optimizing the bedroom for good sleep. So sleep hygiene practices can be very helpful. Journaling has been shown to be a very helpful intervention when trying to improve sleep. And it may actually be a helpful intervention when trying to help clients improve physiological functioning as well. So journaling is a form of self-care. You have gratitude journaling, reflective journaling, just daytime journaling. It's been shown to enhance metacognitive functioning, amongst many other things. Eating healthy plays a huge role in this. We know that. So again, working with a qualified nutritionist dietitian can play a critical role in enhancing and optimizing physiological function as well. And we know this by now, but again, blood sugar regulation, critical component to this. When blood sugar levels are not in sync, it impacts the brain and the body, and it leads to physiological dysregulation. So we talked somewhat about heart rate variability today. An intervention to consider is improving client emotional self-regulation strategies. A lot of things we can do about this: enhancing emotional intelligence, journaling, strengthening metacognitive abilities, biofeedback, neurofeedback, meditation, mindfulness, all kinds of different strategies that people can use to enhance emotional self-regulation. If we can help clients enhance their self-control, their ability to pause, reflect, and think through their actions. Look at all the benefits associated with this, including improved physiological recovery from stress. Other things to consider: improved gut health can play a role in helping the entire body work better. And if you look at this through a psychogastroenterology lens, this is basically gut brain psychology. These are interventions that have been talked about in the literature: relaxation techniques, mindfulness, stress management, gut directed hypnotherapy. Exercise, again, we've talked about that a few times now, but working with a qualified exercise specialist can play a role in this. We know the benefits of exercise are many and varied. Physical exercise can help our autonomic nervous system work better. Yoga can be a really critical intervention as well for some clients. They may do quite well with this, obviously, making sure they are cleared to do so by their healthcare provider, and whoever's providing the yoga therapy is a qualified, certified, licensed professional who has advanced training in this area. But yoga has been shown to help our bodies just work better, run better, can help brain functioning, helps us sleep better. It can help us reduce stress. It's been shown to increase self-regulation or mood, building resilience. Some potential benefits of yoga, just to show you here visually. There's several studies that have shown that yoga can be effective for mental health. There's several studies that have used yoga interventions within the context of the criminal justice system now. So the benefits of this are many and varied. Forest therapy may be another variable to consider. Wilderness therapy, getting clients out in nature more. This study is particularly related to adolescents who are on probation. Just getting out in the natural environment has been shown to help our nervous system, our autonomic nervous system, and our endocrine system work more effectively. Looking at this literature through a green space exposure literature base basically is looking at the benefits of just being out in nature around wilderness and trees and the woods more. It can help us move more. It's been shown to reduce our physiological response to stress, improve social connectiveness, amongst all kinds of other things. More benefits associated with this. Study after study has shown that green space exposure can really help improve functioning on a multitude of levels. Enhancing the entire family system, providing caregivers and parents with education and training around these topics, understanding attachment, understanding attunement, enhancing emotional quality amongst caregivers and that child is vital. We know the role it plays in brain and body development, and it can also help that child develop greater physiological regulation strategies. Sensitive, responsive, warm, attachment-based parenting practices. We all know this, but just to point out the literature, it can help children develop better physiological and behavioral self-regulation strategies. From a parenting caregiver lens too, helping parents increase parental self-efficacy skills, infusing this information into the treatment of mental health populations is vital. Understanding the HPA axis, our immune system, the brain, the nervous system, our hormones, inflammation, the gut, it's all interconnected. Working with a qualified professional to teach clients how to breathe more effectively can play a role. Staying hydrated, avoiding low-grade dehydration is another intervention to take into account. Self-compassion interventions can actually help us enhance physiological functioning. It can help activate the parasympathetic nervous system to help our bodies get back to balance. These are just some of the benefits associated with self-compassion. Self-compassion has also been studied within the context of helping people make better health decisions, enhancing your client's ability to understand, make sense, and appreciate humor might be another variable to take into account that we don't think about. Writing, journaling, learning how to express our emotions, another helpful practical strategy. Enhancing interoceptive awareness, helping your clients learn the connection between what's going on in their body and their mood state, heart rates, hunger, all of these things are very, very important in helping a client reach more balance and homeostasis in their body. Transcranial magnetic stimulation is another variable to take into account. Obviously, you would want to have advanced training and certifications in this area. These are just some basic strategies I think I showed all of you in another training, but I wanted to remind us there's all kinds of interventions out there that can help activate our parasympathetic nervous system. And as we wrap up today, I just wanted to leave you with other strategies through a relaxation and meditation lens, and all of these things may also help our brain and body work more effectively. I appreciate all of you taking time out of your day and listening to today's recording. If you have any questions, please reach out to the email address I provided to you at the beginning of today's training. Thank you, everyone.